Question 2. Scenario: a 40-year-old woman presents with weight gain, moon face, and hypertension. Laboratory tests show elevated cortisol levels and a high ACTH level. A high-dose dexamethasone suppression test suppresses cortisol levels. Question: what is the most likely diagnosis? A. Adrenal adenoma. B. Ectopic ACTH syndrome. C. Pituitary adenoma. D. Primary adrenal hyperplasia. E. Exogenous glucocorticoid use. Check. Answer and explanation are in description section of this video. Question 1. Scenario: a 55-year-old man presents with muscle weakness, hypertension, and hyperkalemia. Laboratory tests show elevated cortisol and ACTH levels. A high-dose dexamethasone suppression test fails to suppress cortisol levels. What is the most likely underlying cause? A. Pituitary adenoma. B. Adrenal adenoma. C. Small cell lung cancer. D. Primary adrenal hyperplasia. E. Exogenous glucocorticoid use. Check answer and explanation in video description section. Question 3. Scenario: a 35-year-old woman presents with weight gain, fatigue, and irregular menstrual cycles. On physical examination, she has a rounded face, supraclavicular fat pads, and purple striae on her abdomen. Her blood pressure is 150/95 of a millimeter of mercury. Laboratory tests reveal elevated serum cortisol levels that do not suppress after a low-dose dexamethasone suppression test. Question: what is the most likely cause of her condition? A. Adrenal adenoma. B. Cushing's disease. C. Ectopic ACTH syndrome. D. Exogenous glucocorticoid use. E. Primary adrenal hyperplasia. Question 2. Scenario: a 50-year-old man with a history of small cell lung cancer presents with muscle weakness, hypertension, and hyperkalemia. Laboratory tests show elevated ACTH and cortisol levels. A high-dose dexamethasone suppression test fails to suppress cortisol levels. Question: what is the most likely diagnosis? A. Cushing's disease. B. Adrenal adenoma. C. Ectopic ACTH syndrome. D. Primary hyperaldosteronism. E. Pheochromocytoma. Question 5. Scenario: a 28-year-old woman presents with hirsutism, acne, and oligomenorrhea. She has a history of weight gain and easy bruising. Laboratory tests show elevated cortisol levels and a normal ACTH level. What is the most likely underlying cause of her condition? A. Pituitary adenoma. B. Adrenal adenoma. C. Polycystic ovary syndrome, PCOS. D. Exogenous glucocorticoid use. E. Ectopic ACTH syndrome. Question 6. Scenario: a 40-year-old woman presents with fatigue, weight gain, and depression. On examination, she has thin skin, proximal muscle weakness, and hypertension. Laboratory tests show elevated 24-hour urinary free cortisol and undetectable ACTH levels. Question: what is the most appropriate next step in diagnosis? A. MRI of the pituitary. B. CT scan of the abdomen. C. High-dose dexamethasone suppression test. D. Measurement of late-night salivary cortisol. E. CRH stimulation test. Question 7. Scenario: a 45-year-old man presents with hypertension, hyperglycemia, and central obesity. Laboratory tests show elevated cortisol levels that suppress after a high-dose dexamethasone suppression test. Question: what is the most likely diagnosis? A. Adrenal carcinoma. B. Ectopic ACTH syndrome. C. Cushing's disease. D. Primary adrenal hyperplasia. E. Exogenous glucocorticoid use. Question 8. Scenario: a 30-year-old woman presents with weight gain, acne, and hirsutism. She has been taking prednisone for rheumatoid arthritis for the past 2 years. Laboratory tests show low ACTH and cortisol levels. What is the most likely cause of her symptoms? A. Cushing's disease. B. Adrenal adenoma. C. Exogenous glucocorticoid use. D. Ectopic ACTH syndrome. E. Primary adrenal hyperplasia. Question 9. Scenario: a 25-year-old woman presents with weight gain, fatigue, and amenorrhea. On examination, she has a buffalo hump and purple striae. Laboratory tests show elevated cortisol levels and a normal ACTH level. Question: what is the most appropriate next step in management? A. MRI of the pituitary. B. CT scan of the abdomen. C. High-dose dexamethasone suppression test. D. Measurement of late-night salivary cortisol. E. CRH stimulation test. Question 10. Scenario: a 60-year-old man presents with weight gain, hypertension, and hyperglycemia. Laboratory tests show elevated cortisol levels and a low ACTH level. A CT scan of the abdomen reveals a 4 cm adrenal mass. Question: what is the most appropriate treatment? A. Transsphenoidal surgery. B. Adrenalectomy. C. Ketoconazole D. Radiation therapy. E. Observation.